So good morning, everyone. Here in the New Orleans Summer Cancer Meeting in 2025, we just finished the first session. One of our great colleagues from Dana-Farber, Professor Robert Haddad, gave us a master lecture on the updates in head and neck cancer and the news that are happening this year, especially from ASCO. So, Robert, thank you for being here.
Yeah, thank you.
We really appreciate that. So, can you give us just a brief key points of your presentation today in the development of what we are doing in head and neck cancer these days?
Yeah. The major advancement really we've seen in 2025 has to do with neoadjuvant Keynote 689 trial, which is a positive trial that led to FDA approval of neoadjuvant pembrolizumab in head and neck cancer. So it's a surgical trial where patients who are going to be treated with surgical resection receive perioperative pembrolizumab before the surgery, followed by the addition of pembro to chemoradiation or radiation. The study was a positive study showing an improvement in event-free survival for those patients, leading to an FDA approval. So we can say today that we have a new standard of care for surgically resectable head and neck cancer patients with perioperative immunotherapy in that space. It's a great excitement in the field and a new treatment for patients.
Good. So I like when you say that this is going to be a shift on the paradigm when we discuss cases at tumor board. So with more emphasis that the surgeon needs to consult with us, to make this MTD, in favor of the patient. It's not like you see the patient from the surgical standpoint and take the patient right away to surgery. I think that is going to significantly change, correct?
Absolutely. Very important to have the tumor board and the multidisciplinary clinic involved early on in the management of the patient as to determine who are the patients that should receive neoadjuvant immunotherapy before their surgery, so that a window of opportunity is not missed in those patients.
Dr. Haddad, and you as an expert in head and neck cancer, can you tell us what would you foresee coming up in the near future in this field?
Yeah, so the big focus right now really is number one, we know that neoadjuvant immunotherapy works, so we have to build on that data by potentially look at combination therapy as the next step, adding to pembrolizumab, whether it's another checkpoint inhibitor or chemotherapy or other targeted therapy. Also, there's a lot of excitement in the recurrent metastatic space with the newer EGFR inhibitors in combination with immunotherapy. So in the next 5 years, I would say, I'm hoping we will see more exciting data in the recurrent metastatic space to build on what we currently do with the checkpoint inhibitors.
Thank you. So, Dr. Haddad, thank you for being here again, and looking forward, please join us here in New Orleans for the New Orleans Summer Cancer Meeting. This is 2025 years, but next year, we are ready to be here by July 17. So hopefully everyone can come. Thank you.